Hello, my name is Pedro Fayoni, and I'm going to talk about the effects of vaccination on invasive pneumococcal disease. Definition: we have invasive pneumococcal disease is defined as an infection confirmed by the isolation of a Streptococcus pneumoniae from a normally sterile site.
I'm a pneumococcal germ, but please, call me Pneumo. I'm a germ with a dangerous reputation. I mean, come on. You don't make 4 million children
Is pneumococcal disease. It's caused by a common type of germ. When someone with a disease coughs or sneezes, the germs can spread to other people. Most of the time, people who get pneumococcal disease only have mild symptoms, but sometimes the germs can cause serious problems like ear, lung, blood, or brain infections. Some of these infections can make people very sick and may lead to hospitalization, months of recovery, and even death. Pneumococcal vaccines are the best way to protect yourself from these germs and the diseases they cause. Who needs to get vaccinated? Everyone does at some point. It's especially important for babies and people aged 65 and older, as well as people with a weakened immune system, like a person with kidney failure, cancer, HIV, or an organ transplant, or an ongoing health condition like heart disease, diabetes, asthma, smoking, and alcoholism. Pneumococcal vaccines are very safe, but like any medicine, they can have side effects. Common side effects include a sore arm where you got the shot, or a fever, and they go away in a few days. How do I get vaccinated? It's easy. You can usually get the shots at your doctor's office or local pharmacy, and vaccination is covered by most insurance plans. If you're a parent, pneumococcal shots are already part of your child's regular vaccination schedule. Okay, let's recap. And brain systems or certain infected.
Now, applications in medicine. Pneumococcal disease is common in young children, but older adults are at greatest risk of serious illness and death. There are two kinds of vaccines that help prevent pneumococcal disease: pneumococcal conjugate vaccine or PCV13 or pneumococcal polysaccharide vaccine or PPSV23. CDC recommends pneumococcal vaccination for all children younger than 2 years old and all adults 65 years old or older. Vaccines that help protect against pneumococcal disease work well, but cannot prevent all cases.
Pneumococcus is a bug that causes a range of infections, from ear infections through to pneumonia, that's the commonest cause of pneumonia worldwide, through to what we call invasive pneumococcal disease, which we really worry about, which is really bloodstream infections and meningitis. Invasive pneumococcal disease is where the bug gets into the bloodstream or causes meningitis, an infection of the lining of the brain. And those are really the most feared infections caused by this bug. And with meningitis particularly, around 1 in 4 children who get the infection will be left with some permanent damage from it, either hearing loss causing deafness or some sort of delays to their development caused by brain damage from meningitis itself. And that really is the reason why vaccination is so important against this bug.
Now, pros and cons. Pros. We have the reduction of the disease among young children and adults who receive the vaccine. The death rate has dropped considerably. Cons. We have that the vaccine still cannot be distributed to all infected people, so disease caused by non-vaccine serotypes increased by 33%. Since then, they have helped slash the estimated number of cases of invasive pneumococcal disease. Despite this, outbreaks still happen. Vaccines can help protect your child from 14 serious diseases by age 2. Issue applied in Ecuador. In Ecuador of 2011, pneumonia was reported to be the first cause of morbidity in general population and the second cause of death in children, becoming a public health problem. Current vaccination strategy in the countries does not cover all circulating serotypes.
Early in my pediatric career, I cared for a 3-year-old girl who had an ear infection. Her crying did not improve with the antibiotics. The bacteria had spread to her brain. She had a pneumococcal disease. This bacteria causes lung infections or pneumonia, brain infections, sinusitis, blood infections, and ear infections. People die from pneumococcal diseases. Antibiotics can treat it, but it's better to have never gotten sick. Fortunately, there is a vaccine that protects children less than 5 years old and people over the age of 65. Talk with your doctor about which vaccine is best for you.
And for the last, we have the conclusion. In conclusion, we have that it's necessary to apply the pneumococcal vaccine to people every year since it prevents disease and death in people. It is necessary to continue researching and conducting clinical trials to be able to make better vaccines that can cover most of the serotypes.
One of the most important vaccines we have helps to prevent invasive pneumococcal illnesses, which can include serious middle ear and sinus infections, lung infections, bloodstream infections, and meningitis. Those patients at the earliest and latest ends of the age spectrum are the most vulnerable to serious complications of pneumococcal disease. The childhood dose is typically given at 2, 4, and 6 months of age, with a booster dose later. The standard recommendation for adults is to give a single dose at age 65. Earlier immunizations may be available under certain circumstances or for certain high-risk populations, such as those with immune deficiency, chronic lung conditions, cigarette smokers or former smokers, diabetics, those with sickle cell disease, or those living in long-term health care facilities.
St. Francis Medical Center, building on excellence.
Thank you.